This is chapter 10, muscular system. This chapter is all about muscles. So just like bones, where you learned all the parts of the bones and different bones in your body, in this chapter you will also be talking about muscles, all the different types of muscles that you have in your body. We're going to start off in this chapter talking about the actions and interactions of skeletal muscles. We're going to talk about how they came up with the names. It kind of makes it easier for you to memorize the names of the muscles if you know how the muscles are named. And then briefly about mechanics and importance of the fascicle arrangements. Because of the muscles' function is to contract and move the bones, depending how the fascicles, remember fascicles are bundles of skeletal fibers. So based on how they are arranged, the movements depend on that. So we're going to briefly talk about that. And since the muscle moves a load, we need to talk about the relationship, the lever systems, different types of lever systems that we have in our body. And then lastly, it is all about muscles. All the major skeletal muscles of your body will be dealt in this chapter. Remember that there are too many muscles in your body, so I'm going to pick and choose, just like how I picked and chose the different parts of bones. I'm going to pick and choose the muscles that you need to know in this chapter. So let's start with the initial groups of skeletal muscles that we have. Depending on how the muscles move, we have different functional groups in our body. There are 4 of them total. The first one is your prime movers. That means this muscle provides a major force to move or do a specific movement, like flexion or extension, one of those. And another group is that opposes these prime movers. So this one is a same kind of function, one particular force, but it opposes the prime movers. So if the prime movers are flexion, then the antagonists are going to be the extension movement. The next type of functional group you have is synergists. These guys help. They help the prime movers. They reduce undesirable and unnecessary movements. That are their main function. The last one is fixators. Because all muscles do not have to provide some kind of movement, and some actually has to stabilize the bone that it is in, you have these fixators. So these kind of immobilize a bone or muscle origin so that the movement can be much more smoother. So these are the 4 functional groups of skeletal muscles that you have. Naming of skeletal muscle. The example that I'm going to give you will help you understand abdominis, rectus abdominis. So you know from the name rectus abdominis that recta means it is straight. Okay, abdominis is where your abdomen is. So this muscle is straight and is located in your abdomen. There are many names that you can actually hear and kind of understand where the naming nomenclature came from. So based on where your skeletal muscles are located, the muscle can be named accordingly, like abdominis, right? Shape. So based on how it is, you can actually call that muscle by that name as well. The example that's given over here is deltoid. Deltoid is triangle shaped, so it's deltoid muscle. Relative size, that'll be your gluteus maximus, gluteus minimus. So which one is bigger, which one is smaller, so you can name it accordingly. The next one is direction of fibers, oblique muscle. We call that because the fibers are running in an oblique direction, right? Rectus, running straight. Transverse, running transverse. Oblique, in an angle. So based on all those things, you have these naming. The other type of naming that you can use is based on where they originate. Remember I said muscles have an origin and have a place of attachment. So based on those two, you can actually name a skeletal muscle. Biceps. Biceps means it has 2 origins. Point of attachment. Where is it going to insert itself? My classic example I give is sternocleidomastoid muscle. It's a muscle in your neck. So if you turn your neck, you can see that muscle protruding along the lateral side of your neck. So that muscle, sternocleidomastoid. So it has sternum. Cleido means clavicle, and mastoid process. So basically you have all these three origin and attachments found in this particular muscle, and hence this muscle is named accordingly. Action, flexors, extensors, they're found in your forearms, so you have all the muscles named after their action. So this basically will tell you how we name the skeletal muscle. So while you're learning the different types of skeletal muscles in your body, keep in mind that the name will actually help you to remember the muscles better. Even though we're not going to do attachments and origins in this chapter, the naming will tell you, like sternocleidomastoid, it will tell you where your muscle is going to attach and originate from. Now let's talk about the fascicle arrangements and all the different types that we have in our body. Remember, our bones are of different shape. The movement are going to be different. So that means the muscles are also going to have to be different shapes. So based on their function, your structure changes. Now, these are the different types of fascicle arrangements that we have in our body. I'm going to start with the circular one. The circular one over here just tells you that there's an orifice, meaning an opening, and the muscle surrounding that opening is either going to close or open that orifice, right? The example it's given is orbicularis oris. So over here, it is found around your mouth. That means it helps in pursing your mouth, closing and opening your mouth. So that is a reason why the fascicles has to be in circular arrangement, so it permits that kind of function. If the fascicles start off with a broad area and they all converge and attach to one point through a tendon, it's called as convergent fascicle type. Example is pectoralis major. So it covers the entire thoracic area and then all of them merge together to form an attachment at your humerus. The third type of fascicle arrangement is parallel, meaning the fascicles are all parallel to each other. Example is sartorius. Sartorius run in a diagonal position on your thigh and it helps to cross your legs. So that is basically a parallel arrangement fascicle. Next one is a pennate. Pennate are of different types. You have your unipennate, you have your bipennate, and you have your multipennate. What is pennate? Pennate is when you have a central tendon and from that you have all the fascicles, right? Or fascicles going to a central tendon, right? So it can be uni, meaning one-sided fascicle, and then you have the tendon. It can be bi, where the fascicles on both sides, and in the middle you have the tendon, just like a feather of a bird. Okay, and then it can be multi, where you have multiple areas where the fascicles start off, and then you have your tendon in the middle. So that will be your pennate. And then you have a fusiform. Fusiform is the fascicle is in the center, bulged up, and at the ends you have the tendons forming and they merge at the ends. So that is basically the fusiform. Example will be your biceps. For unipennate, you have your extensor digitorum longus. Remember the name, extensor digitorum, the place where it goes, longus because it is long muscle. Bipennate, rectus femoris, it is a thigh muscle. And then multipennate will be your deltoid, the shape of the muscle. The next we're going to talk about are a little bit of mechanics, muscle mechanics and lever system. Before we go further into all the different type of lever systems we have, we need to know the components. The lever, the bar itself, and in our body it's going to be a bone. And then you have a fixed point, which is fulcrum or the joint in our body. The effort that is put by the muscle, the load is whatever we're going to move. That'll be in our body, the bone, tissue, whatever weight we're carrying, all those things. Now let's look at all the different types of lever system that we have. Okay. we have the first class lever system, and then you have the second class lever system and the third class lever system. For you to move a load, you need all these three: a load, fulcrum, effort. Okay. In the first class lever system, the fulcrum is in the center like this. The load and the effort is in the corner. The example in a layman terms, it'll be your scissors. So this is your first class lever system in your body. So when the posterior neck muscle move, your fulcrum moves, the atlanto-occipital joint moves, and then your head moves backward. So this is basically a human body example for your first class lever system. And then you have your second class lever system that in your body, it's going to be your heel. Okay, so what happens over here is the fulcrum is at the end. So here is how it looks. So fulcrum is at the end, the load is in the middle, and the effort is going to be at the other end, like a wheelbarrow. Okay, the effort over here where you're lifting, the load is in the center, and the fulcrum is the wheel. Okay, so in our body, the fulcrum is your toe that you think about tippy toeing. Then you have the entire body weight, that'll be your load, and the effort is by your calf muscles. So when you lift up your entire weight on the tiptoes, the calf muscles take up all the weight. And that is one of the reasons why wearing high heels actually accentuates the calf muscle, because you're technically lifting your entire body weight by the calf muscle, which is not good for your toes. The next type of lever system we have is a third class lever system, where the fulcrum is again at the end, but the effort is in the center and the load is in the end, instead of in the second class system where the load was in the center. Now you have the load at the other end. Example will be your tweezers, and you're lifting something with the tweezers. In your body, it's going to be lifting something with the help of your biceps muscle. So that'll be your effort, fulcrum right over here, and the load on the other hand. Okay, so this basically are all the lever systems that you have in your body and how your muscles actually move the load. Okay, now let's move on to the muscles. Now this is where in your book it describes the name, description, origin, insertion, action, and innervation. For our class purpose, you need to know the name, you need to know the description, you need to know the action. The origin, insertion, and innervation we are not going to do for our course. Okay, again, name, description, action of muscles that I am going to describe in a few minutes. We're going to start off with the muscles of the head. We have two different groups of muscles in our head. We have the facial expression ones and the muscles for mastication, movement of the tongue. Now, let's talk about the muscles of the facial expression first. The muscles that are responsible for facial expressions are attached or inserted to your skin. So that basically means that your muscle is going to, since it is attached to the skin, it helps the movement of the skin, hence the facial expression that you have in your body. So all the muscles that you need to know. Let's start off with the muscle that is found in your forehead. Okay, so here are your epicranius muscle. So you have the frontal belly and you have the occipital belly. So this one starts off over here. The frontal belly is over here and the occipital belly is over here. In between, you have a sheet of aponeurosis. That'll be your galea aponeurotica. So what happens if this muscle, if you contract the frontal one, skin is pulled closer. That means you're going to have wrinkles on your forehead. And then when you're done wrinkling your forehead, the occipital pulls back and now everything is fine. The scalp moves backward to its normal position. That is basically what you're going to see in epicranius, also called as occipitofrontalis muscle. It pulls the scalp forward and backward. That is its own only function. So depending on which one moves, like the frontal one covers the forehead, and that basically causes the eyebrows to rise over here, okay? The eyebrows to rise and wrinkles your forehead horizontally, okay? That is your frontal belly. Occipital belly, on the other hand, pulls it back to its original place, okay? Now, the other muscle that you have to know is the one that actually draws your eyebrows closer together. So that'll be your corrugator supercilii muscle. This is starts the muscle of your face. This was your muscle of your scalp, okay? Then you have the muscle around your eyes. That'll be your orbicularis oculi. Orbicularis oculi, its sole purpose is to blink, closing of your eyes. Okay. Then you have your zygomaticus. Zygomaticus, you have your major and minor. So these are the two muscles, the minor over here, the major over here. You can see those. This is for pulling the angle. You can see how it ends at the angle of your lips, right? So it pulls, when it contracts, it pulls the angle of your lips upward. So it is a smiling muscle that you have, okay? The next muscle that I want you to know is your levator labii superioris. So the levator labii superioris is also going to your mouth. So what does this do? It rises and furrows your upper lip, opens up your lip, okay, opens up your lip. Then you have depressor. If this is it elevates, right, this one depressor labii inferioris draws, look where it is over here, right? It's almost to the angle. So when this contract, it pulls it downwards, right? So when you basically, like a grimace, or a pout, I would say, not a grimace, but a pout. That's basically what it draws the lip inferiorly. Okay. Depressor anguli oris. Depressor anguli oris. This is the one that causes the grimace. Okay. Depressor anguli, right over there, angle, right? Depressor anguli oris. Okay. And then you have, we already talked about orbicularis oris when we were discussing the fascicle, opens, purses your mouths, right? Like kissing movement, right? So that's orbicularis oris right over here. Then you have your buccinator, which is an important muscle that you need for pursing or whistling or suckling motion. So when you are sucking something from the straw, you're using that. It also is a very important muscle that you use for chewing purpose. Okay. Mentalis is your chin muscle that wrinkles your chin, or wrinkles your chin right over here. Okay. And then platysma. Platysma is the one that when men shave their neck, they kind of stretch their neck. That is the muscle that they use in their face. Okay. So you have all these muscles that are responsible for facial expression. You have the epicranius, causing the horizontal wrinkles in your forehead. You have the corrugator supercilii, rises your eyebrows. Corrugator supercilii is for drawing the eyebrows together. So the wrinkle is straight, it is vertical. So if you wrinkle your corrugator supercilii, the wrinkle will be over here, vertical. Okay. Now, and then you have your levator labii superioris, levator labii inferioris, and then you have your zygomaticus minor and major. You have your buccinator for chewing or suckling motion, whistling too. Orbicularis oris for kissing purpose. So remember, like how I'm mentioning, I'm telling the action of the muscle as well. Okay. Mentalis, that's when you wrinkle your chin. And then you have your anguli oris, that's the grimace. The platysma for stretching your neck muscle. So these are all the facial muscle that you have in your body. Okay. Now these muscles that you have in this picture are the muscles that are responsible for mastication. Okay. Temporalis muscle, it is called so because you can see that's where your temporal bone is. So it covers the entire area. So that's your temporalis muscle. It helps to close the jaw. It's like a spring. It attaches to your mandible and it closes. The coronoid process of the mandible is where it inserts and it closes the mandible, so closing the jaw. Okay, and then you have the masseter. The name itself tells you a prime mover of jaw closer. It helps in masticating. That'll be chewing. Okay, buccinator that we talked before. It is also responsible compressing the cheek and helps to grind the food. Orbicularis oris keeps the mouth closed. And then you have these two muscles. You see over here, those two muscles we already discussed about in the facial expression. So we're going to move on to the next muscle that we have that helps in the mastication process itself. That'll be your pterygoids. So you have your lateral pterygoid and your medial pterygoid if you remove the masseter. What is its function? Both the pterygoids are responsible for grinding movement. So your medial pterygoid helps in protraction of the mandible and side-to-side grinding as well. Your lateral pterygoid is for side-to-side grinding. Okay, so they all help in mastication of your food, the chewing purpose of your food. Okay, now let's look at the muscles that are in your tongue. So the muscles in your tongue are, your tongue is basically made all of muscle. Okay, so that's basically what we're going to talk about. We have your genioglossus, we have your styloglossus, we have your hyoglossus, the three muscles that make up your tongue. You can see the genioglossus is forming the floor of your tongue, and it fans out. It helps in protraction of your tongue. So protraction is inside movement. Okay, it pulls it in back inside. And then you have your retraction. A retraction is actually pulls it inside. Protraction is outside, pulling it outside. Okay, so pulling the tongue outside. Retraction is your styloglossus. So you can see over here, the styloglossus helps to pull the tongue backwards. Styloid process, hence it's called a styloglossus, originates from styloid process and goes to your tongue. Okay, hyoglossus. Now this is where hyoid bone comes in, right? So again, origination of your muscle is hyoid bone. You can see over here, and it goes all the way. It goes all the way up over here to your glossus, to your tongue. What is its purpose? To depress it, so it can push the tongue downwards. Okay, so these are all the movements that you have of all the muscles in your body. Now let's look at the muscles of your neck. They're divided into two groups, suprahyoid and infrahyoid, based on where they are located. Okay, so here you can see all the muscles of your neck region. These muscles help in swallowing purpose, right? So it helps in swallowing and speech. Okay, for our sake, all I want you to do is list them. You need to know, no need to know individual muscle and their actions, but as a group, what do they do? Okay, list them, list suprahyoid muscles, and as a group, what is its function? Let's talk about suprahyoid muscle. Remember, suprahyoid is above the hyoid bone. So here is the hyoid bone right over here. So all the muscles above them are your suprahyoid. All the muscles below them are infrahyoid of your neck. So the suprahyoid muscle are your digastric. So digastric has two bellies, right? You have the anterior and posterior belly. You have your mylohyoid muscle. You have your stylohyoid muscle. So here's your mylohyoid. Here's your stylohyoid. Here's your digastric muscle. And you have your geniohyoid, which I don't see it over here. So it's a geniohyoid too. What is its function of all these muscles function? This group, a suprahyoid muscle group, helps to basically form the oral cavity floor. Remember, mandible is a U-shaped bone that has to be covered. So these muscles, suprahyoid muscle groups, help to form the floor of the oral cavity. They anchor the tongue as well as elevate the hyoid bone and helps in swallowing by moving the larynx superiorly. Okay, so when they contract, So when they contract over here, all these muscles over here, they lift up the hyoid bone, and the larynx basically moves during swallowing purpose. Okay? All right. Elevate the hyoid bone. That's your suprahyoid muscle group. Let's look at the infrahyoid muscle group. Infrahyoid is your sternohyoid right over here. And you have your omohyoid on this side, okay, inferior belly, and then superior belly over here, omohyoid. And then you have your thyrohyoid bone, and then sternohyoid bone. Sternohyoid is the one that originates from your sternum and goes all the way to your hyoid bone. Sternothyroid, on the other hand, stops at the thyroid cartilage. That's the reason why it's called a sternothyroid. Okay. Omohyoid, the inferior belly over here, and it goes all the way in an angle and goes to your hyoid bone. So what do? It starts with the scapula, superior surface of the scapula, and goes and attaches to your hyoid bone. Thyrohyoid. So thyrohyoid is a short one, starts with the thyroid cartilage and goes to your hyoid bone over here. What is its purpose? When they contract, what are they going to do? They depress the hyoid bone, so they push it downward, the hyoid bone downwards, and helps the larynx to swallow. So initially you elevate the larynx, and then you basically push it down so the food can go further down. So that's its function. The other type of neck muscle that you have is important for swallowing purpose will be your pharyngeal muscle. Okay, so you have three different types of pharyngeal muscles in your body: superior pharyngeal constrictor, middle pharyngeal constrictor, and inferior pharyngeal constrictors. They also help in swallowing by constricting the pharyngeal muscles. So initially the larynx is opened upwards to receive the food. Once it is received, then it has to push it downwards. How does it push it downwards? By constricting these pharyngeal muscles. It pushes it downwards so the food can pass to the esophagus. That's basically how your pharyngeal constrictors help in swallowing of the food itself. The other muscles that you have in your body are going to be your neck muscles that are found anteriorly. Okay, so over here you see your sternocleidomastoid muscle right over here. Okay, like I said, the origin is from the clavicle over here and the sternum, sternocleido, and then the insertion is the mastoid process of your temporal bone behind your ear. So that's basically why the muscle is named like that, sternocleidomastoid. What is its function? This function is to flex the neck and laterally rotate the head. Okay, so when you move your head laterally, that's basically what causes the muscles to contract. Then that you have bunch of scalene muscles. So you have your anterior, you have the middle, and you have the posterior scalene muscles. They originate from the cervical vertebrae, the transverse process of the cervical vertebrae, and they attach to the ribs depending where it goes. First rib and the second rib. So you can see the posterior scalene goes to the second rib. The first rib is your anterior and middle. Okay. What does it do? Because they're attached to the rib, when they contract, what is it going to do? It's going to pull it above. So it's going to elevate the first two ribs. When do you elevate your first two ribs? When you breathe, right? So during respiration process. So that is basically the muscles that are found and in anterolateral portion of your neck. Okay, then the posterior portion of your neck, you have your splenius muscle. The splenius muscle are of different portions. Okay, just like scalene, you have middle, anterior, posterior, you have a splenius, capitis, and cervicis. Okay, why do you have capitis? Capitis, wherever you see capitis, it means head. Cervicis means neck portion. This is for extension, hyperextension purpose. Remember I said the posterior muscles of your neck help in the first class lever system? These are the muscles that are going to extend and hyperextend. How do they do that? Because they're attached to the mastoid process, so the neck is pulled backward, the head is pulled backward when you use these muscles. Now we're moving on to the back muscles. There are different types of back muscles. The main function of all the back muscle is for back extension. That means if you are standing straight, that means you're using these muscle groups. Okay, your back muscle group, neck, and your vertebral column muscles. Okay, so let's look at all of them. We're going to start off with your erector spinae muscle. Erector spinae muscle, the name itself tells, keeps your spine erect. There are three parts to that muscle. Okay, it's also called as sacrospinalis muscle. This is the prime extensor of your back. Okay, iliocostalis, longissimus, and spinalis. Okay, they extend your vertebral column and laterally flex your column as well. Okay, now let's move on to the next group of muscles. We call it as semispinalis muscle. Semispinalis, you have different groups as well. You have your thoracis, you have your cervicis, and you have your capitis. What is its function? Extension as well, and helps to rotate your head in the opposite direction. Okay, and then the last one is your quadratus lumborum. Quadratus lumborum is the strongest muscle that you have on both sides. What is its function? It flexes the vertebrae laterally, so it moves your vertebrae laterally. Okay, now remember that the reason why the neck muscles, especially the back muscles, are really prone to pain is because of the posture itself. When you bend down and you just get up without bending your knee, if you bend down, that means your back muscles, when you flex your abdomen, that means your back muscles are completely in rest. Okay, to pick something up, you bend down, right, without bending your knee. So the back muscles are completely in rest and you get back up straight, meaning now all of a sudden the back muscles are starting to be engaged again because it keeps your vertebrae straight, right? So that from complete relaxation to complete working mode causes a lot of pain, lot of problems in the back, which can also lead to intervertebral disc herniation and injuries to your back. So what is a proper way to pick something up from the floor? To bend your knees, so you're not completely relaxing your back muscles. Okay, now we're moving on to the thoracic region of your body. Thoracic region, the muscles that are located in the thoracic region are all responsible for breathing movement, elevating the thoracic cage itself, which helps in breathing. You have your external intercostal muscle right over here, internal intercostal muscle, and then you have a diaphragm underneath your rib cage. Okay, so what is its function? The external intercostal muscle is found from the inferior border of the rib above. So it goes from above the rib above, inferior border right over here, and joins at the superior border of the rib below in this direction. Okay, but the internal intercostal is the opposite. Okay, it starts with the superior border of the rib below and goes to the inferior border of the rib above. Okay, that's how it forms. So because of its fascicle, how it runs, if you look at your rib cage, you're going to have a crisscross kind of muscle going on. So you have the one starting from above going down below, that'll be your external. One starting from below going above, that'll be your internal. Okay, why do you have these crisscross? So you have proper movement of your rib cage. The external intercostal muscles, when they move, they elevate the rib cage. So when they contract, they move the rib cage above. The internal intercostal muscles, when these guys move and contract, they depress the rib cage itself. Okay, and the diaphragm over here, when they contract, they tend to flatten and they move upwards, making the thoracic cage smaller. Okay, all right. The external intercostal muscle is the muscle that we actually use when we breathe. So this will be your inspiration. Okay, inspiring the air. Inspire. This one, internal intercostal, we usually do not use this muscle, but this is for expiration. Expiration. Okay, so why don't we use this muscle for expiration? Expiration is a passive process, meaning the air comes out by itself. It doesn't need muscle. We only use this muscle when we have to have like forced expiration. Forced expiration when we're breathing harder and we need to expel all the air. Like after a workout, you might use this. Or when you have asthma attack, your muscles are used in that case. So that'll be your internal intercostal muscles. Diaphragm, you use it all the time. Without diaphragm, you will not be able to breathe at all. So here's a picture of your diaphragm. Okay, now we're moving on to your abdominal region. Abdominal wall does not have any bones. So that means these muscles, there are a lot of different muscles in your abdominal area, and they actually overlap to try to protect your internal organs. Okay, that's its function. It contains all your abdominal organs inside. What all muscles do you need to know? All of them. Transverse abdominis, internal oblique, external oblique, rectus abdominis, and linea alba. Okay. So let's start with your rectus abdominis. Rectus abdominis is this muscle that is found right along the midline. Okay, so this side it's not seen, but you can see over here when you remove the aponeurosis of your external oblique, you can see the rectus abdominis underneath it. Okay, this is the muscle that is responsible for six-pack that you have in your belly. What causes the six-pack? Because of these tendons that are there between the fascicles. So you have your tendinous intersection found between the muscle itself. So when you work out, these area hypertrophy, but because it's a tendon, they do not get hypertrophied. So you end up with six-pack or eight-pack, whatever pack it is. Okay. Linea alba is the central or the midline. And then we move on to your obliques. You have the external oblique, which actually starts from the ribs. You can see over here, and it goes and attaches basically along the linea alba. That'll be the aponeurosis over here. And some goes all the way to your pubic crest over on this area as well. Okay, internal oblique. So you have your muscle starting from this direction, moving that direction for your external obliques. Now let's look at the internal obliques. Your internal obliques, on the other hand, starts off at the iliac crest over here and then goes all the way to the linea alba like that. Okay, that's your internal oblique, okay, and goes to your ribs. Okay. So your muscles are going diagonally. This one is going this direction like this, and your internal oblique is going the opposite direction like that. Okay. Transverse abdominis, straight. Okay. So you have your transverse abdominis. If you remove all this muscle, you can actually see transverse abdominis. Or in this picture, you can see your obliques and your transverse abdominis. So here's your oblique starting from your ribs going all the way to your alba. Okay, and here's your internal oblique starting from the iliac crest and going towards the linea alba and the ribs. And here's a transverse going sideways. Okay, so that's basically what all you have in your abdominal cavity. Now let's look at their function. Rectus abdominis is found in the middle, along the midline, right over here, right? So what do they do when they flex? They pull the trunk downward. So it helps in flexion of your lumbar region and as well as rotation of your lumbar, okay? And vertebral column. External oblique, what is it going to do? It's going to compress the abdominal wall, just like your transverse abdominis and your internal oblique. Okay, they both internal and external and transverse abdominis. They're going to compress your abdominal cavity, meaning they're going to increase the abdominal pressure. Okay. So those are the abdominal muscles that you have in your body. Now we're going to move on to the pelvic region. The pelvic region of your body, remember the pelvis over here is an open space, right? Right over here. So it has to be filled. Just like the mandible has to be filled, your pelvis also has to be filled with the muscles. You're not going to learn all the muscles, but you need to know which one forms your pelvic diaphragm. The pelvic diaphragm is important because that's the one that closes up the pelvis, right? So you have the levator ani and coccygeus muscle. So here's your coccygeus muscle and here's your levator ani over here, okay? What do? Levator ani holds the pelvic viscera, that's your internal organs, and also helps basically when you cough or vomit or any of those things, it resists anything coming out. Okay, so that's basically what it does. It forms a sphincter at the anorectal junction. That's what your levator ani is going to do. Coccygeus muscle also helps to support the pelvic viscera and helps in defecation process as well. So those are the two muscles that forms your pelvic diaphragm. And then you have your urogenital diaphragm that are found in your region, pelvic region as well, or the pelvic floor as well. Okay, so what all do you need to know? External urethral sphincter, it is found around the urethra, helps to hold the urine until you want to expel it, right? And then you have your deep transverse perineal muscle. That'll be this muscle over here. It supports the pelvic organ as well, the same as the levator ani and your coccygeus muscle. So these are the four muscle groups that you need to know of the pelvic floor and the perineum of your body. Now let's move on to your anterior and posterior region of the thorax. Okay. The thoracic region, before we talked about, were the muscles that are found are responsible for breathing. These are the muscles that actually help in the movement of your upper body or the upper limbs. Okay, so we're going to start off with the pectoralis muscle. You have your pectoralis major. We already talked about that a little bit. Now we're going to talk about more of it. So this will be the pectoralis major muscle all the way from your sternum going and attaching to your humerus. We'll also talk about it in your upper limb when we get to that. It is your flexion for your arm flexion and rotation of your arm medially. That's what, and moves your arm towards the midline. That'll be your adduction. Okay, that's your pectoralis major. If you remove the pectoralis major, underneath you have your pectoralis minor. Okay, so the pectoralis minor is found right over here. So you can see how the pectoralis minor starts off at the ribs. So you have the 1, 2, 3, 4, 5 ribs. So fifth rib, that's basically pectoralis minor for you right over here. Okay. What does it do? It draws the scapula forward and downwards. That's what it does because it attaches to the coracoid process of your scapula. Okay. Then you have serratus anterior. Serratus anterior is the boxer's muscle. You see over here, it kind of develops in people who work out a lot. So that's the boxer's muscle, serratus anterior. So what does that do? Again, rotates the scapula. So the inferior angle of your scapula moves laterally and upwards. Okay, that's what, when you hit with like a boxing movement, that's basically what you do. Laterally and upward. That's your serratus anterior muscle. So these are the muscles of your attached to your scapula. Now let's look at the posterior view of your muscle itself, of your thoracic region. Okay, posteriorly, what all do you have? You have your trapezius. Okay, you have your rhomboids, minor and major, and you have your levator scapulae. Okay, all those muscles. We're going to talk about latissimus dorsi when we talk about the upper limb. Okay, let's talk about the trapezius. Trapezius rises and retracts the scapulae. Why? Because here you can see it goes to your occipital bone and then continues, attaches to the scapula, and then it goes all the way down to the vertebrae. So all the way from the occipital, and it goes all the way to the thoracic vertebrae, and it converges over here and inserts to the scapula, the acromion process, and as well as the spine of the scapula. So what is it going to happen when it contracts? When it contracts, it's going to rise, retract, and rotates the scapula, like shrugging your shoulder. And this is the muscle that gets tensed up a lot, and people have headaches even because of tensing up of trapezius muscle. Okay. Then you have levator scapulae. The name tells you what it's going to do. Elevate the scapula. Adduct, the adducts the scapula, and because it is attached, look at this, medial border of the scapula. So it kind of pushes the scapula towards that, adducts towards the midline, and also elevates the scapula. Okay, rhomboid minor and major. So if you remove the trapezius, you're going to see your rhomboids, right? You have the small one minor and the larger one major. Okay, what are they going to do? They're going to stabilize the scapula, and they're going to square the scapula, like when you're standing straight and you're squaring the shoulder. And that's basically what the rhomboids are going to do. Okay, now this finishes your upper girdle. Now we can move on to your upper limb. Like I said before, the pectoralis major is part of your upper limb because they help to rotate the arm medially and also adduct the arm and helps in flexion as well. Okay, so here is your pectoralis major. It starts at the sternum, the clavicle, all these things, and then they converge because it's a convergent fibers. Fascicles converge and they attach to the intertubercular sulcus between the two tubercles that you have in your humerus. It attaches over there. Okay, so that is your pectoralis major right over here. Okay, and then we have your deltoids right above. Deltoids, because it's a deltoid shape, you can see how it origins from the clavicle, acromion, and the spine of the scapula and attaches to the humerus at the deltoid tuberosity at the shaft of your humerus. What is it going to do? When it contracts, it's going to abduct, move away from the body midline, right? And that's basically what it is. It's a prime mover of abduction of your arm. That'll be in the anterior portion. If you look at the posterior view of your muscles of your thorax that moves your arm, you have your latissimus dorsi first over here. This is the broad muscle. It starts from your vertebrae and then it goes all the way to your spirals. You can see it kind of twists and attaches to your, again, intertubercular sulcus of your humerus. What is its function? Its action is a prime mover of arm extension. Okay, arm extension. So that means if it contracts, it's going to keep the arm straight. So it's going to pull the arm this way. Okay, so that's basically what your latissimus dorsi is going to do. And then you have a bunch of muscles that are going to be found either in the scapula, and it helps for your humerus rotation. Okay. Remember, when a muscle crosses a joint and attaches to the bone, like for example, your deltoid, it starts off at the scapula, crosses your shoulder joint, attaches the humerus. That means its function is to move the humerus. So it has to cross the joint if you want that joint to move. That's basically what you're seeing over here. So latissimus dorsi crosses the joint, shoulder joint again attaches to the humerus, hence it is for extension. Okay. The muscles that are found in your arm, your in your humerus, we'll talk about that in a minute. Okay. So let's start with the supraspinatus. You have your infraspinatus, teres minor, teres major, all those muscles, right? Teres minor and teres major are going to they're going to be over here. Okay. So you can see them both posteriorly and anteriorly. Now let's look at these supraspinatus and infraspinatus muscle. Spine is over here. The fossa, supraspinatus fossa, infraspinatus fossa are found here. So the fossa are filled with muscle. Supraspinatus muscle, infraspinatus muscle. Okay. And then if you go anteriorly, you have the subscapularis fossa. That is going to be filled with subscapularis muscle. Okay, subscapularis muscle, it's not seen over here, but it actually is a medial rotator of your humerus. Supraspinatus is for abduction, and infraspinatus is a lateral rotation. Teres minor does the same thing as infraspinatus. You can see how they actually follow the same course. Okay. Teres major, on the other hand, medial rotation and adduction of your humerus. Okay. So that's basically the muscles that you have in your thoracic region and in your pelvic girdle, your scapula, that crosses your shoulder joints and attaches to your humerus. Now we're going to talk about the muscles that cross your elbow joint and helps in the movement of your arm. Okay, so that means we're going back to looking at this picture right over here. Okay, so you have your triceps brachii, biceps brachii, brachialis, brachioradialis, coracobrachialis as well. Coracobrachialis is for flexion and adduction of your humerus. Triceps is a powerful arm extensor. Biceps is a powerful arm flexors. Brachialis is a major forearm flexor. Brachioradialis is a synergist to your arm flexor, forearm flexor. Okay, so remember, when I say forearm flexor or arm flexor, you have to keep in mind, right? Powerful triceps is forearm extensor. Okay, coracobrachialis is for humerus, not forearm. Okay, forearm is where your radius and ulna are located. Okay, biceps brachii is for forearm flexion of your elbow joint as well as your supination of your forearm. Brachialis, major forearm flexor. Brachioradialis, a synergist to your forearm flexor. So these are the four muscles that you need to know. Now let's move on to the actual forearm itself. Okay. Now this is where I want you to know the group of muscles in your forearms. I'm not going to go into details of all the forearms muscles that you have. Let's look at what I want you to know. Okay. So this is basically what I want you to know in your forearm. Forearm has compartments. You have your posterior compartment muscle group and you have your anterior compartment muscle group. The anterior compartment muscle group are called as flexors. So you can see that you have the muscles that are innervated by median and ulna. We'll talk about that later. But they are flexors. Okay, what are they going to flex? They're going to flex your wrist and your fingers. The muscles of your forearm crosses your wrist joint, attaches your phalanges, metacarpals, and your carpals, right? Hence, flexing your wrist and your fingers. Posterior group, on the other hand, helps to extend your wrist and your fingers. Okay? because they go attach again, crosses your wrist and goes attaches to your metacarpals and your carpals and your fingers, right? Hence, the posterior compartment are all extensors and your anterior compartment are all flexors. That is basically what I want you to know in your forearm muscle group. In this course, I'm not going to go into detail about all the muscles that are found in our hand. That'll be too much detail for 200 level course. So I'm going to skip all the muscles that are found in your hand. Now we can move on to the lower limb. Let's talk about the muscle that is found anteriorly. So you have a muscle group called as iliopsoas muscle. So that's basically what you're seeing over here, iliopsoas. It's made of P silent again. Psoas major and iliacus. So what are they going to do? So iliacus is found in that fossa that I told you, in the iliac fossa. And here is your bigger muscle, psoas muscle. The iliacus is responsible for flexing your thigh or flexing the trunk on your thigh. So it pulls the trunk on your thigh or thigh towards the trunk, okay? Psoas major basically does the same thing. So it causes the lateral flexion of the vertebral column as well, okay? So those are the muscle groups that you have. And then you have serratorius. Remember I said they have parallel fascicle running together. So here is your serratorius running all the way over here. So it runs oblique. So it starts off laterally and goes medially. Okay. So it flexes abducts, AB, abducts, and lateral rotation of your thigh. Flexes your knee as well. So when you sit in the crisscross position, this is the muscle that works in your body. And then when you move on medially, you have adductors over here. It's one of the adductors that you see over here. There are many. You have adductor magnus, you have adductor longus, you have adductor brevis. Okay, you have 3 adductors. What do these adductors do? You should know from the name. Adducts means towards the midline. So that's basically what it's going to do. Rotate the thigh towards the midline. That's what it's going to do. Above the adductors, you have a small muscle called as pectineus muscle right over here. Pectineus muscle adducts and flexes and medially rotates the thigh just like your adductors. And then you have your gracilis muscle. Okay, gracilis muscle, when you look at an animal, when we do dissection of a rabbit, you're going to see the gracilis is much more pronounced than what we have in our body. Why do we need this gracilis? It's a muscle that you use for walking. So this too helps in medial rotation of your leg and adducts your thigh as well. Okay. Now, if you move on anterior part of your thigh, you have your quadriceps femoris, which is made of rectus femoris, vastus lateralis, vastus medialis, and you also have vastus intermedius that is not seen over here. Okay, you have vastus intermedius. What is its function? Look at where it is attaching. So it basically starts off from the hip bones and it goes to your knee region. So what's its function going to be? Its function is going to extend the knee and flex the thigh at the hip region. So that's basically what its function is. While it is attaching to the knee, it also stabilizes the knee. Remember I said the muscles crosses the joint, actually stabilizes the joint as well. Okay, so that's the function of quadriceps femoris. Okay, this is the anterior portion. Now let's look at the lateral side. Lateral side, there isn't much going on except this muscle called as tensor fascia lati. Okay, because there's a long tendon, right? You call that tensor fascia basically. It goes over there. So because it's going laterally, it stabilizes your knee laterally, flexes and abducts the thigh as well. Okay, so that's basically the muscles that you're going to see anterior and laterally of your thigh. Now if you go posteriorly, so what are you going to see in your thigh? The first thing that we have is your gluteus muscle. Again, different types of gluteus muscle depending how big it is. Gluteus maximus, gluteus medius, and gluteus minimus. What are they going to do? They're going to extend your thigh. That means extension of your thigh is moving it backward, right? So that's basically its function too. Extensor of your thigh, mainly the gluteus maximus function. The medius and the minimus also helps in medial rotation of your thigh and abduction of your thigh as well. Okay. Lateral rotators, if you remove your muscles, the gluteus maximus and minimus, you'll see that you have your piriform muscle over here and bunch of obturator muscles. The piriform helps in thigh movement laterally, rotation of the thigh movement laterally, and the synergists are going to be obturators, the external, the internus muscle, and all those things are going to be synergists. Apart from this, you have also quadratus femoris right over here. Quadratus femoris rotates the thigh laterally. You can see how it is attached to the head of the femur from the ischial tuberosity. It rotates the thigh laterally, stabilizing the joints. So these are all your hip muscles that you have in your body. Okay. Now let's look at the posterior thigh muscles that you have, right? So here it is. The posterior thigh muscles, we saw the hip muscles posteriorly, the gluteus and piriformis and obturators and all those things. Let's look at the posterior thigh region. You have your hamstrings, okay? Hamstrings are made of biceps femoris, semitendinosus, and semimembranosus. Three muscles together are what we call it as hamstrings. Okay, based on how they are, semitendinosus, you have a lot of tendons. Semimembranosus, there is a thin membrane. That's basically what it is. Okay, semimembranosus is found deeper. You can see how they are deeper to the semitendinosus. Tendinosus run superiorly to the semimembranosus, hence membrane, thin, sheet-like, right? Okay, what is its function? Biceps femoris, all these three actually extends your thigh and flexes your knee. Extends your thigh meaning the thigh goes backwards, and flexion of your knee meaning this one is pulled upwards, right? Your knee is pulled upwards, so flexion of your knee. So that's the function of your hamstring that you have in your body. Now let's look at your leg movement muscle and also the anterior and the posterior view of the muscles. Anteriorly, here's your anterior border of your tibia, and you have muscles on both ends. Because there are no muscles covered, you can actually feel them under your skin. Okay, so what do you have over here? I do need you to know certain muscles. That'll be your tibialis anterior. Tibialis anterior is the dorsiflexion mover, prime mover of dorsiflexion, inverts your foot. So here is your tibialis anterior. You can see how over here, and it pulls the foot upwards, right? So inversion of your foot, and inversion of your foot is this side, and dorsiflexion is going upwards, okay? And then you have extensor digitorum longus. This one attaches to your toe, and it helps in toe extension, okay? And fibularis, okay? Fibularis, right over here, tertius or peroneus, you can call them both, dorsiflexion and eversion. Eversion is this side, right? This side of the foot. Inversion is this side of the foot. Dorsiflexion is upwards. Plantar flexion is downwards. Okay? All right. So you have your fibularis tertius, dorsiflexion, eversion of your foot. And then you have fibularis longus, fibularis brevis. They're all for plantar flexion. Tertius is this, okay? That helps in the eversion. Let's look at the other muscles that I said. Fibularis longus and brevis. See if you can see it over here. There it is. Fibularis longus and fibularis brevis. Because it's in the lateral side, it goes towards the fibula. You have those. Here's your brevis and here's your longus. Okay. What do? Plantar flexion. You can see how it attaches to the underside. So when this muscle contracts, it pulls the foot this direction, right? Plantar flexion of the foot, and also eversion. So that means the foot goes this side towards lateral, okay? Laterally pulled. Posteriorly, you have your triceps, which includes your gastrocnemius and soleus. Gastrocnemius and soleus. Let's look at a better picture posteriorly. Okay, so here's your posterior muscle where you can see the gastrocnemius, the two heads of the gastrocnemius muscle. Together, they're bunched up as triceps surae. Okay, so that'll be your gastrocnemius. When you remove the two bellies of your gastrocnemius muscle, you can see underneath that the soleus muscle. Now here are the bellies of gastrocnemius, and here's the important tendon of gastrocnemius, calcaneal tendon, and attaches to the calcaneus of your foot. Okay, calcaneal tendon. This is the one that makes a popping sound when it breaks and your foot drops. So what do you think its function is? Its function is plantar flexion of the foot. Okay, plantar flexion of the foot is caused because of these triceps surae muscles. Okay, then you have something called as plantaris. Plantaris for plantar flexion as well as knee flexion. Now you can see in this picture the triceps muscle. When you remove the gastrocnemius, you have the soleus underneath it, right? They have cut that, and you can see the tibialis posterior muscle. Tibialis posterior muscle is responsible for foot inversion. Okay, foot inversion. We talked about the plantaris already, and here's your popliteus, a tiny muscle found in the popliteal fossa. Popliteal helps the medial rotation of the leg and to unlock the extended knee. That's what it does, and flexion of your knee as well. That's its function. So those are all the muscles that you need to know in your leg of your body. I'm not going to do the foot muscles of your body. So just to keep in mind, just like hand, I'm not going to do the foot muscles either. Now in this picture, you can see the compartments. Your leg has been divided into compartment, your anterior compartment, your medial compartment, and your posterior. Medial helps to pull your leg medially, so that'll be your adduction, includes your adductors. And then you have your anterior compartment, that'll be your quadriceps femoris, that helps in the extension of your leg. And you have the posterior compartment, the flexion of your leg and extension of your thigh. And that's basically all the different compartments found in your thigh region. So over here you can see the muscles of your leg, the anterior compartment, posterior compartment, and lateral compartment. So your anterior compartment helps in dorsiflexion of your foot and your inversion of your foot as well. The lateral compartment helps in the plantar flexion and eversion of the foot. The posterior compartment, plantar flexion of your foot and flexes your toe as well. So these are all the different compartments that you have in your body. So as I said, we're not doing the foot. So that means with this, we conclude chapter 10.